Hello and welcome to week 9 of NUR1000. First, we're going to go over the week 8 assignments. You did a discussion board that was just a pretty laid back midterm check-in. And I'd say overall, the reflection from the first half of the semester was pretty positive. There were a couple things that were noted in multiple different posts, some concerns that students were having. So I did forward those on to the other faculty. Didn't put anyone's name, didn't identify, you guys didn't even identify who you might be having issues with, but just really generalize, like, here's some concerns students are having so that we can try to improve upon those concerns. And what I forwarded on to faculty were the concerns about communication not being quite up to par, inconsistencies between different labs and clinicals for the same cohort of students. What else was there? Oh, the feeling that you're doing busy work in the classroom and the clinical, so not understanding the purpose for assignments. And of course, the bookstore, the book issue was brought up or passed along as well. So again, I didn't use any student names when passing on those concerns. I just mentioned that multiple students had the same concerns, and here's sort of what they were, so that hopefully faculty can address those concerns and finish out the semester smoothly with you all. The second activity you did was prioritization questions. So let's take a look at those. Okay, so for these practice questions, just a reminder, you get credit for putting forth a good effort in doing the assignment. It's fine if you don't get them all right. You're starting to practice test-taking strategies, and especially for first semester foundation students, there's a lot you still don't know. So it's more about learning these strategies than understanding everything about complex disease processes that you're going to learn throughout the program. But let's take a look. I just randomly select some assignments to show as we're going through them. So I pulled one up here. You got a client who's experiencing delusions about being poisoned. No evidence of dehydration or malnutrition at the time. The nurse creates a plan of care for the client and would include which need as the priority. The answer options then were self-esteem, physiological needs, safety and security, and love and belonging. And so you were supposed to reword the question, put in the strategic word if you identify one in caps, and then put your correct answer and your rationale. So what's the highest priority the student did with capitalizing priority? That was what we were looking for. That reminds you, okay, this is a prioritization question. I'm going to do physical safety feelings, then my ABCs, and sort of go on with the different test taking strategies that we talked about. This one is kind of tricky. And this is nursing school in a nutshell, right? You learned physical safety feelings. B, physiological or physical needs is actually not the correct answer for this one. The reason why they're saying no evidence of dehydration, malnutrition. So he or she worried about being poisoned, but they're still eating and drinking. So that statement is letting us know that physically they're okay. And then from there, C becomes the correct answer. So it's never black and white in nursing school. The maintenance of safety is an important consideration when working with clients who have delusions. Because it's saying we're okay physically, B wasn't the correct answer for that one. So let's look at this next one, see what we're thinking. 2, you have a client admitted to the neuro unit from the emergency department with a diagnosis of a cervical spinal cord injury. What action would the nurse take first when admitting the client to the nursing unit? You could listen to breath sounds, check the peripheral pulses, check for muscle flaccidity, or determine extremity muscle strength. So this student put, what will the nurse do first? What action will the nurse take first? That is correct. And the student bold or caps that first. That's our prioritization strategic word in the question. So that was perfect. Let's see here. This student picked A because of breathing, the ABCs. So what are you going to do first? Listen to breath sounds is correct. And that's the perfect rationale. They're all physical answer options, right? There's no safety or feelings. So we've got our priority physical answer options, and from there we then go ABCs, breathings, obviously the B and ABC that we're looking at there. So respiratory is my priority, A is correct. Let's keep going. Priority intervention for a client having a severe asthma attack. Give oxygen, provide a calm environment, administer quick relief rescue med, or give a long-term preventer medication. The student put, what would you do first? What would you do first for someone who's having an asthma attack? The first is fine. She reworded it using this priority word. You could have left priority in, most important. Any of those types of words would work in your rewording. So very good there. And she picked C, which is the correct answer. These types of question, this type of question can be confusing for students at a certain point, throughout the program, not just any certain point, because a lot of people want to give oxygen. For this one, the client's problem was an asthma attack, and the rescue medication, like an albuterol, would fix the problem of the asthma attack. And for that reason, C is a better answer than A. Now, what can be confusing is if you get a question where what's the priority nursing intervention for a client who has, let's say fibrosis of the lung. So the lung's not working properly, but the problem with the lung is different than the problem with asthma. So in that case, the quick relief wouldn't be the correct answer. Oxygen would. So that can be confusing, but that's our NCLEX questions. That's why we're taking this class and trying to learn some strategies. Question 4. Nurse is caring for a client with an injury to the brainstem. The nurse would monitor which parameters as the priority? You got urine output, electrolyte results, peripheral vascular status, or respiratory rate and rhythm. What's most important is capsed here. D, because of the ABCs, is correct. Respiratory is our priority there. Very good. Question 5, the nurse is carrying out emergency care for a post-op patient who's suspected of having a PE in the lung. The nurse would implement which primary healthcare provider prescription first? Give oxygen, start an IV, obtain an ECG, or obtain ABG specimens. She reworded it as what should the nurse do first? And D, she picked obtain an ABC gas specimen. That's actually going to be incorrect. So if you were looking at that, what would you think might be the correct answer for saying get this ABG specimen out? Default, keeping in with the respiratory to A. A, apply oxygen is the correct answer. So even though this question doesn't tell us what their SpO2 is, unless it's saying the oxygen, the SpO2 is 100% and it wouldn't make sense to apply oxygen, getting that oxygen on them would be prioritized over drawing ABGs, right? Because this is an intervention that can help fix the problem, if that makes sense. That was a tough one. And oftentimes the question would give you a little bit more information about the patient's oxygenation status, which would help lead you to that applying oxygen as being the correct answer. So that was kind of a hard question. If we keep going, the nurse is caring for a patient who's being treated with IV lidocaine for irregular heart rhythm. The nurse will plan to monitor which items closely? Temp and radial pulse, urine pH and urinary output, radial pulse and peripheral pulses, or respiratory status and BP. What's most important to monitor is a great rewording there. And she picked D, respiratory status and blood pressure, because why? In terms of prioritization, this most important is telling me I need to think about prioritizations. Physical safety feelings. They're all physical options. From there, I go to my ABCs. I have breathing, respiratory status, answer option here. That makes it a priority. A lot of people, maybe not a lot, some people wanted to put pulses because they saw the irregular heart rhythm. But remember, in terms of ABCs, airway breathing is above circulation. For that reason, D is the correct answer. 7, you got a client who sustained a smoke inhalation injury arriving at the ED. On assessment, the nurse knows the client's confused and combative. We worry they're experiencing what problem? Pain, fear, anxiety, or hypoxia. What's wrong with them? D, hypoxia is the correct answer. Again, it reinforces that respiratory status is a priority concern for us. hopefully with the smoke inhalation, you were thinking about their respiratory status and what problems they might be having. 8, assisting for a hospitalized client with suspected MI who's experiencing chest pain unrelieved by nitroglycerin. They get morphine. After the administration of the morphine, what's a priority? Monitor urinary output, monitor respirations and the BP, put the patient supine with the legs elevated, put the call light at the bedside and tell them to call if the pain's not relieved. What should you do next? Next is fine. Priority, most important, immediately, whatever you want to put there. B is what the student picked, monitor respirations and blood pressure because of the ABCs, and that is correct. Nurse is caring for a client ambulating after prolonged bed rest. Nurse determines the client must immediately stop the activity if they exhibit what finding? Arm and leg weakness, shortness of breath and diaphoresis, increased pulse rate from 78 to 80, increased respiratory rate from 16 to 18. She said, what is the incorrect or bad finding? You could keep that immediate still in there. So like what needs intermediate or what needs immediate intervention? She did pick the correct answer here. B, shortness of breath and diaphoresis because of the ABCs. Last one. Oh, no, it's not the last one. Number 10 here. After receiving handoff report, who are you going to see first? This one is confusing for students. First, priority would be a strategic word to keep there. Many students do want to pick A because of that elevated heart rate. I'll say my heart rate gets to be 110 pretty quickly if I'm grading students doing skills checkoffs. So although it's abnormal, it's on our radar, but there's something that we'd prioritize even over this elevated heart rate, and that is B, order client on chemo with mental status changes. And the key word for this one, why we're prioritizing it, is because of changes. So anytime a patient has a change in their condition, they become a higher priority patient. Meds here. Let's see. Let me look this one quick. You got an order for 50 milligrams, so the correct answer was 2 mLs. Then you had some arranging and order type answer or questions here. For the hand washing, you're going to wet your hands, apply soap and lather, scrub for 20 seconds, and then rinse and dry. This last order question is about witnessing someone collapse and then prioritizing the order for CPR. So for this one, if you remember back to your basic life support, your BLS training, you're going to check for responsiveness is the first one. So you're going, hey, you all right? You all right? Then you're going to check for breathing and check for a pulse at the same time. So if I were a student, you could probably argue that one either way. Then again, why nursing is difficult. In this situation, you would begin chest compressions and then open the airway after a round of chest compressions. So remember with that basic life support where it's now CAB, compressions, airway, breathing. So sort of different. And that's really the only circumstance where you would see that. Quick review of week 9 expectations. You're going to read chapter 9. You actually have 3 recorded lectures, the welcome greeting that you're hearing now, a recording about delegation and some item types. Oh, it's right here. And then a little math recording. You got a discussion board about stress management and then practice questions related to delegation. You do have a final project in this course, and you can find the final project description and rubric listed under the Canvas Important Information module. So take a peek at that. Let me know if you have questions. That's due November 12th, a Tuesday, because of Veterans Day. You'll also have a final reflection paper. That rubric is also contained under the Canvas Important Information module. So look at the rubric that tells you how to get full points. That's due on December 2nd, and the Dropbox for that will open up 2 weeks prior to that.